Going to be talking about a brand new study that came out, and it's really looking at a specific tapeworm drug and how this may be a potentially new treatment for neurological disorders. So, in this video, what I'm going to share with you is the findings of this study, and I'm also going to share with you why it is being considered as a repurposing this drug to treat neurological disorders. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago, so this topic is really important to me because recovery for me really involved treating parasites. And there is this slow trickle of research that we're finding is coming out. And I shared last week, we talked about a different parasite drug that can be helpful for MS also for certain people. But today we're going to be talking about a different drug. And this drug is called niclosamide, and it is an old 50-year-old tapeworm medication. So if we haven't met, I just wanted to share that I am Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And the topic today, we're going to be talking about a specific study that just came out this year. It's a 2023 research study, scientific peer-reviewed study. And the name of the name of the scientific study is called Repurposing Niclosamide for the Treatment of Neurological Disorders. And again, published this year, so it's hot off the press. And it is in the journal Neural Regeneration Research. So niclosamide, let's just talk about niclosamide for a moment. So let's discuss this old parasite drug, niclosamide. It was originally sold under a different name in 1962, and it was called Yomesan, Yomesan. So that was its original name, and then it got a new name and the new name was niclosamide. So this parasite drug, it is FDA approved, and it is used to treat worms, used to treat tapeworms. And so it's been used for over 50 years, so it has a very good safety record, and it is included in the World Health Organization's list of essential medications. So it is an essential medication. It has been incredibly helpful, saved many lives. It kills tapeworms, and that would be in the gastrointestinal tract, so in our digestive tract, in our intestines. But it's also showing that it is effective in different conditions, like if people have solid tumors, or maybe they have rheumatoid arthritis, or different fibrotic conditions where they have fibrosis. We'll talk about that more in a minute also. So it is currently in phase 2, phase 3 clinical trials for metastatic colorectal cancer and also prostate cancer and COVID-19. Who would have thought? So it's being studied for these 3 different conditions in clinical trials. So the use of niclosamide to treat neurological diseases, it's been suggested many times in different studies. So this is nothing new. It's just that this study has kind of put this information together. And so it's believed that this parasite drug can cross the blood-brain barrier, and that would be really helpful for people that have neurological conditions, because we know, like if you follow my work, for anybody that is just listening to my work or listening to this video for the first time, maybe you are not familiar with the work that we do. So we believe with Live Disease Free, that is who we are. We live disease free. And what we believe is that all chronic diseases are caused by some type of infection, chronic infections that are not picked up by our standard of care. And so when these infections are treated properly, which we call parasites, any microbe that lives in us and causes us harm is a parasite. So that could be worms, fungi, bacteria, protists. There's lots of different types of parasites. Some of them are larger than others, and some of them cause more problems, and they like to live in different parts of the body. So this is where the research is going. So there's really great research coming out of Calgary, Alberta, Canada. shout out to the University of Calgary, where they're really talking about dysbiosis, and there's many other places they're talking about dysbiosis, meaning we're really out of balance. We have too many disease-causing parasites and not enough health-promoting microbes in our body. And so when we're out of balance and we get to this tipping point where our immune system can no longer deal with the parasites, then we end up with really strong symptoms and we get a disease label. Again, different parasites like to live in different parts of the body, which is so interesting because niclosamide, and this is true for a lot of the parasite drugs that I've been sharing with you and other ones that we haven't talked about yet, but cancer is quite different than rheumatoid arthritis. That's in our standard of care medical model of how we use or how we have our healthcare system. It's like if you have MS, you see this expert. If you have arthritis, you see a different expert. If you have cancer, it doesn't matter what disease, could be inflammatory bowel disease, you see a gastroenterologist. So every disease has a different specialist, but where we believe that no, it's just you got different parasites. And if your practitioners would be able to treat that early, we wouldn't need all these specialized practitioners. We just have to figure out which parasites we're dealing with. So niclosamide I've used it in the past. I tested well for it and I had a prescription for it. And I didn't notice any negative effects of it at all. And with some of the parasite drugs, you have to take them like 2 or 3 times a day. With niclosamide, it's more that you're taking one bigger dose per day. But it is effective against different tapeworms. It may have other applications too. You can look it up on just online. You can find information from all kinds of different pharmaceutical websites. But again, cancer, rheumatoid arthritis, and different fibrotic conditions, and COVID-19, like very, very different applications. So these parasite drugs, the more we research them, we see that there are many different parasite drugs that cure cancer, for example. And our students that are recovering from different diseases, they usually test well for 3 to 5 parasite drugs at one time. I tested well for 5, and probably because I'm older and I've had MS for years, which has been in remission for years, but I was never able to treat those parasites very well until I added in the parasite drugs, and then it was a game changer. So the nice thing is that, or what we have to realize, I should say, is that there's not going to be one parasite drug. So a disclaimer for today, niclosamide is not going to cure MS, ALS, Parkinson's, etc. But if you have tapeworms, then taking parasite drugs is going to really help to get those parasites out of you, especially a drug that's geared towards tapeworms if you have tapeworms, and then all kinds of symptoms can go away. So one thing that's really important to talk about too is that, remember, I've shared in the past, Dr. Alan McDonald found tapeworm larval cysts, so like little bladders of developing tapeworms, and also just developing tapeworms. So the immature form, but also little worms developing of tapeworms in the central nervous system of MS patients. So that means that we probably quite often have tapeworms. I don't know about all the time, but it could be very common. And so a drug like niclosamide can be helpful. It's maybe not the main drug for treating that condition, and we call that neurocystic psychosis, when the little immature tapeworms get into the central nervous system. Then we might have to use different treatments, but niclosamide definitely treats tapeworms, and that would treat the adults in the intestines. But our experience is that the parasite drugs are helpful, but they're not a cure on their own. And that's why we use the approach that we do with Live Disease Free. We stop feeding the infections, we support the body, people are feeling a lot better. Then they get energy tested, and they usually test well for 3 to 5 parasite drugs at one time. And then they're being guided with their practitioner, et cetera, to make sure that they're using the treatments in an effective dose, but that they're using them safely. You have to work with somebody when you're treating, right? These are pharmaceuticals, and I'm not against pharmaceuticals. I always want to treat the cause. I think that it's really important that we cure and recover from these diseases. And I use the word cure, but if these diseases are caused by parasites and you treat the parasites, then you can be cured. But it's not super easy treating. Like if you've had an infestation for years and years, it takes a little bit of strategy, because they're pretty persistent. It's just like I'm starting to grow tomatoes for the first time in a few years, and we're out in the country and we've got all these stupid stink bugs. And I've never had a problem with stink bugs in town, but they're just appearing from everywhere and sucking the juice out of the tomatoes. So think about like the pests in your garden is very similar to the pests inside your body, and they can be persistent, and you have to use strategy to get rid of them because they produce baby or eggs, I should say. First of all, they can lay hundreds of thousands of eggs in a day. Then they can lay dormant inside of you for long periods of time. They can hide under biofilms. So they're challenging to get rid of, but we can find a cure if we treat the cause. And that's what we all want, right? If we've been diagnosed with disease. So niclosamide is the topic for today, and it has been shown to be helpful and maybe useful in treating different types of neurological conditions. So this study that I'm sharing with you, they didn't talk about all neurological diseases, but there's a lot of overlap and similarities. And we see that with the students we work with, whether it's ALS, PLS, Parkinson's, or MS. There is this overlap of symptoms we deal with because we're probably dealing with an overlap of some of the same parasites. So um, niclosamide has anti-inflammatory effects in the central nervous system. So that suggests that it is dampening this neuroinflammation that we're dealing with. So neuro means nerves. Inflammation, remember I've shared with you, that is your immune system is fighting something. And the main job, the main purpose of the immune system is to fight parasites, to fight infection. So if you didn't get in an accident, you just have this neuroinflammation, then it is caused by parasites. It's caused by infection, and your immune system is overwhelmed and it needs support. So niclosamide has anti-inflammatory properties in the central nervous system. It's been shown in studies, and so it may dampen this neuroinflammation. And if it's treating parasites in the central nervous system, of course it's going to dampen neuroinflammation because the immune system doesn't have to work so hard if the parasites are decreased or absent. So, drug repurposing, let's talk about this for a minute because this is what they would be doing with niclosamide. It's not a new drug, it's an old drug. It's lost its patent, it's pretty cheap, and drug companies don't really want to promote it because if you're going to sell this drug for, let's say, $100 per treatment, they're used to like huge profits. Like with the MS drugs, for example, they're billed out at least $100,000 to $400,000 per year. So why would they want to sell a drug that they're not going to use? The patient isn't going to use it for a whole year, so it's not even going to be $1,000. And so what they're looking for is, they're always looking for new patents for new proprietary products, right? So with drug repurposing, they're saying that it's really advantageous for companies because it kind of, when you take a drug, an old drug, like, let's just talk about some of the repurposed MS drugs right now. So they've taken old chemotherapy drugs that have lost their patent, and then they give it a new name, and then they do some trials with MS, and they show that it could potentially have some benefit. And then now, because they've invested money in research, and I think it's like at least a couple of $1 million for drug research to bring a new drug to market, it's quite the gig. But then they're like, well, we've spent all this money on research. We've got to spend, we've got to charge a lot for these drugs now, even though they're old and they know the safety track record because they were used in cancer for a while. So it's like, okay, so we can bring it to market quicker. We're going to have less costs for developing the product, developing the drug, but we still need to charge, $100,000 to $400,000 per year because that's what we're used to for profits, right? It's like, where did the curing people disappear to? Where did that go? Is that not the whole purpose of this? Is it not to find a cure? And in this study that I looked at, they don't even talk about curing. None of the studies talk about curing. They're talking about, well, with neurological diseases, we don't know what causes it. There is no cure. And the treatments are used more for just managing symptoms. And so we'd like to try to find some treatments that could possibly slow down the progression of neurological diseases. I didn't see the word cure anywhere, right? And it's like cure is not a profitable word. It's not going to bring in profits for the shareholders for sure. So it's just really frustrating. So again, with niclosamide, they'd like to repurpose it, and because it has been shown to be helpful for certain neurological disorders. And they're like, well, we know the safety track record of it, and it's been around for 50 years, so we don't have to worry about that. We could bring it to market quicker, but of course we would have to do some studies to use it for different applications, not just for tapeworms. But it's like, well, maybe we're still doing the same application. We're just calling it changes in physiology when actually the tapeworms are no longer there. And then we end up not having the inflammation. The immune system doesn't have to work. So they wanted everything in chronic diseases. Like, let's just look at the immune system. Like, is he, pro-inflammatory, anti-inflammatory, autoimmune, all of that, instead of like, gee, I wonder why the immune system isn't working so hard, right? I wonder, this is a parasite drug. I wonder if maybe there's a parasite that's being affected. Maybe it's not a tapeworm. Maybe it's another parasite that is also affected by niclosamide that is being treated. Maybe it's not the best treatment for it, but maybe it's discouraging that parasite enough that the immune system has less activity because it doesn't have to work as hard. And then you have neuromodulation, like your nervous system is not having as much inflammation, so it's decreasing that neuroinflammation. That's just common sense, and that's not profitable, unfortunately. So we talked about Ocrevus. That's just one. We talked about one MS drug, but there are other ones that are repurposed. And please, if you're using some of these treatments, again, I'm not a doctor, I can't give medical advice, but please look at the adverse effects. Any medication that you're taking, how is it working in the body? So read up on the mode of action, and also what are the adverse effects. So like with Ocrevus, it's cancer. So what's worse, cancer or MS? And is it really that our B cells are the problem, or is it that we have parasites? And what we found is that when we treat parasites, we recover from different diseases, all kinds of autoimmune diseases and different chronic neurological diseases. So they're sharing in the study that the number of off-patent drugs is becoming much larger than the new drugs. So it's hard to find new drugs. They're looking and looking, and it takes time to find something potential, and then you've got to make sure it's safe. So they're like, we've got all of these drugs that have lost their patent, and what if we could repurpose them for some reason and use them in a different application, and then we could have a whole new profit, line coming in. So it's less risky and more rapid return on investment. They talk about this in the study. And like all we care about is we want to be cured. We want to get on with our life. We want to be able to drive. We want to be able to raise our family. We want to be able to go back to work. We want to be able to make that difference in the life that we're supposed to make. And that is all lost in this. It's like, well, it's less risky if we could repurpose these old drugs, and we'd have a more rapid return on investment and lower average associated costs once failures have been accounted for. And drug repurposing allows for the ability to move quickly with respect to assessing the drug efficacy. So, they know that it's more safe because, let's say, niclosamide's been around for 50 years, so then they know what dosages people can tolerate, so they can move more quickly in assessing if this drug is going to be helpful or not. Anyhow, so with niclosamide and neurological disorders, so this one particular study, so there's other like MS and other neurological disorders, but they just looked at a few things. They looked at neuropathic pain, and they found that niclosamide, it decreases this condition. So these people that have neuropathic pain, like when they get pain, it's like severe pain. It's not normal pain. And that's a specific condition that comes with neuropathic pain. So they found that decreases. So they have much less pain, and it decreases demyelination, which is in multiple sclerosis and other diseases. So also in people that have neuropathic pain. And it decreases oxidative stress, and it decreases neuroinflammation. Again, your immune system is not fighting so hard, that there's less damage to the nerves. But this was in animal studies. So again, like with MS and with a lot of other conditions, they're using animal studies, which are models. They're using models, which are not the exact same disease, but they're trying to get close. And it's really interesting. I've shared before on how they make these animals sick. It's pretty ridiculous. It's anyhow, I won't go into that because we'll get off on a bunny trail. But Parkinson's disease, they also looked at that. And again, it decreases that condition where they have severe pain. So it decreases pain, and it uh, protects against the axon degeneration, so damage to the nerve with ALS. So there's other things too, but I just wanted to keep it kind of simple here. ALS, it also helps to reduce neuroinflammatory and fibroptic markers. So when we have fibrosis, and then also axonal impairment and muscle atrophy. So it reduces all of that. And that's in animal models. So these are in animal models. So it's anti-inflammatory and decreases the pro-fibroptic pathway. So they have more fibrosis, which is more like scarring of um, different. Fibrosis can happen in different parts of the body, and it's really a thickening or scarring of tissue. It can be highly progressive. So like in ALS, for example, and other conditions, it can eventually lead to organ malfunction or even death. It can affect any part of the body, the fibrosis. And of course, the immune system is involved in that, right? The immune system is trying to deal with something. And we're just not looking for the parasites. We're not looking for parasites. We are just, oh, it's just the immune system. It's just the immune system. Nope, we're not looking for infections. It's just the immune system. But we could take this parasite drug and it's helping. Like, I wonder why. It's just, you just can't make this stuff up. So again, the different conditions that this study considered was neuropathic pain and Parkinson's disease, ALS, which is an awful disease where there's not a lot of help for. Again, it is an infectious disease, and also spinal cord injury and cerebral hemorrhage. Intracerebral hemorrhage. So, in conclusion, with this study, niclosamide is a 50-year-old tapeworm medication. It is very, very safe when used properly. It is really well tolerated. It doesn't have a lot of adverse effects, and it has anti-inflammatory properties or effects in the central nervous system. So that makes it a great drug for repurposing, and it really will help the pharmaceutical companies with respect to, decreasing their costs and the time to get it approved for a different purpose. So if niclosamide is going to be approved for treatment in any neurological disorder, they're going to have a new patent, and then the drug is going to be a lot more expensive again. So it's really going to help them with developing the drug, making the development cost cheaper, but then they could potentially have, if they're allowed to use it for neurological conditions, then they would have another expensive drug to make wonderful profits on. And what I believe in my own personal experience in working with hundreds of students with MS and other neurological diseases is that niclosamide on its own will never cure any neurological disorder. So they're kind of talking about, well, maybe we could use it in conjunction with other drugs, right? And use it just like maybe if you're on a disease modifying drug, you might use Ampera, you might use baclofen, you might use a bunch of other drugs. So they're like, well, maybe the niclosamide could just help a bit, and we could just put it into the mix of what we're giving patients. We're not really looking for a cure. We're just, if we can manage their symptoms a little, possibly manage their symptoms, then we could just, have another profitable drug, right? And it's just sickening. Are you guys sick of this? Like, who else is sick of this beside me? I'm so sick of this. And if you're new to this and you're like, Pam, I don't really know what you're talking about, you should watch some of my videos. Like, I've shared, how we diagnose, even just MS, how we diagnose, how we decide how it's diagnosed and how it's treated. It's blocking any possibility for a cure. It really is. And it's just so frustrating. And until there's an awakening of the general public and awareness of a lot of people, then we're always going to still keep getting the same kind of treatments, the treatments that affect our immune system, that suppress our immune system and do not treat the cause. They do not cure us. They're intended to possibly help our symptoms, which they don't. For most people, they don't. And it's awful. And I was speaking to a person today who's had MS for many, many years. And this person, he really took care of himself. He slowed down the progression of multiple sclerosis. He opted out of the disease modifying drugs for many years. And then he got the you know what in the last couple of years, or not, he didn't get that. He got, there was something that was really encouraged for us all to take because there was this thing going around for the last couple of years with all the lockdowns, remember? So he ended up getting 3 of those. And between that, and then he got offered to go in a study for Ocrevus. And with all of that, it has greatly, really, really taken him down, like with his mobility. It's not that he can still barely walk, but it's getting really, really hard now. And now all of a sudden, the neurologist's like, well, you're getting older and we don't really have anything for you anymore because now it's term progressive and the drugs are more for helpful for the younger people. It's just like, oh my goodness. You do a favor to go in a study and you get, hurt and you just get left. Like it's just, this has to change. Do you guys think it has to change? I sure think it has to change. So I'm going to go to your questions. See if you guys have any comments. All right. So hello, Joanne. How do you spell that drug? Niclosamide. Okay. I wanted to also tell you, I will spell it for you, but what we always do is I do a blog post every week. So on Friday, on our website, livediseasefree.com. Usually later on in the day, we post our blog post. So it'll have the shortened video for today and it will have everything written down. My notes are there written down. So you will be able to click on a link and go right to the study. You'll be able to read my notes. You can forward this to if you have any practitioners that are open-minded and would like to support you in treating parasites, or you just want to educate, or different MS groups, get some discussions going. Please share those blog posts. Just share them and then just peruse, like look at the topics I've been doing every week and you'll be like, oh my gosh, oh my gosh, oh my gosh. Like it's crazy what we're sharing. It is such a wealth of information. It's a gold mine. livediseasefree.com blog posts they're a gold mine. And I have healthcare professionals that are working with us in the Live Disease Free program. And they're like, Pam, I don't know how you have all this information or how you have put this all together. I believe it's by the grace of God. I believe it's a total miracle and it's by His grace that we're doing this work. I don't have all the answers, but I tell you that He's put a lot of the pieces together and He doesn't want us to suffer. I really believe God wants us to live a whole life, and the truth has to come out and we need to treat the cause. So our website, you'll see all of this information that I've talked about today on our website on Friday, every Friday. So make sure to go there onto our website. And if you put in your name and email, if you want to watch my masterclass training, you'll be connected with us so that if I ever get taken down here, you can still stay connected with me. And that's really important in these days too, because I'm talking about things that should not be talked about, but it's very important that we do. So niclosamide is spelled Niclos, Niclos, Amide, Amide. All right. And so niclosamide, but please remember, and I'm telling you this, that it is not a cure for ALS, for Parkinson's, for MS. It could be one of several parasite drug treatments that a person would test well for and use to recover from the parasites that are causing chronic disease. So, for example, if you, let's say, have these tapeworm larval cysts in your central nervous system, then we've talked about other drugs. So praziquantel would maybe be more helpful, but maybe the combination of niclosamide and praziquantel would be even better. And maybe it's a combination of 3 or 4 parasite drugs. So the parasite drugs, what we've noticed is that they're stronger than herbs, but they're not enough to sterilize your body. It's not like when you had strep throat and you took a specific antibiotic, in 2 weeks you recovered. Parasite drugs are not the same. The parasites, it's not like a superficial, like a bacterial infection in your throat. These are throughout, you've got almost like 25 to 30 feet of intestines, your whole digestive tract, and they're hiding in little areas. They move into organs, they form cysts, right, under biofilm. So they persist in our body, and even things like Lyme disease persists in our body. And so we just chisel and chisel and chisel away at it, and we hit it at different angles. We're using oxidizing agents, so oxygen therapies, we're using herbs, and we're using parasite drugs in the combination for what we test well for. And that's what seemed, and the prep phase is super important, the diet and supporting the body first. If you just go into treating when you feel lousy, you'll feel even more lousy because you get die off, right? When you're really sick with all of these horrible neurological disorders, you're toxic, right? You've got a lot of poisons from these parasites running through your blood, in your intestines, etc. So you first want to decrease the burden on your immune system. You want to take some burden off your immune system. You want to promote immune modulation, so important. You want to promote that. So you're feeling better before you start treating. You want to be having daily bowel movements. You want to be sleeping well at night. All of these things, and I share in my masterclass training all the steps we take to do before we treat, how we treat, and just the rest. We do build a healthy lifestyle. Of course, that's all important, but people sort of know that already. But if you're really sick, it's pretty hard to exercise, right? But we still can take back our mobility. We do what we can. We don't overdo it. We don't overspend our energy. But things like sunshine and balance and nurturing your soul and exercise activity and hydration and filtering your water, all those things are important. But why you're sick is because you get parasites. And when you treat the parasites, that is the missing piece of the puzzle for wellness for sure. All right. So, how do you spell the drug? So, I gave that to you. So, you're dealing with Parkinson's. So please know that, and I should maybe do a live event on Parkinson's. If you can do this yourself, just do some searches. Do a Google search of Parkinson's disease and dysbiosis, Parkinson's disease and bacteria, infections. Just do different searches. You can go to PubMed, PUBMED, and you can just do, and you don't have to be a scientist. You don't have to read the whole articles, but you can read the little paragraph at the beginning of these different articles, and you'll see that gut dysbiosis is very well understood in Parkinson's and in ALS and in MS and in PLS and in all these conditions. So, but I think what it is that sometimes specific parasites are going to cross the blood-brain barrier, get into the central nervous system, and then they like to live in different areas and cause different symptoms and produce different poisons. And then we might get a different disease label. But very often, for example, we had one student with PLS and she recovered at least 80% and she was happy she's back to exercising, she's playing with her grandkids and everything. And she used the same parasite drugs that students are using for MS, but she tested well for them. She didn't just randomly take some. And so that is the key, is to use the treatments that are effective for you at effective doses and in combination. So my husband has had parasites coming out of his nose in the shower. I am so sorry to hear that. We have done natural parasite cleanses. We never seem to get them all. Again, I love the parasite, like I should say the antimicrobial herbs, parasite herbs. I love them, but we have not found that they're effective enough, especially when the parasites have moved throughout the body. And if you're dealing with really large ones in the intestines, where you can reach oxidizing enemas in the large intestine, but you can't reach the small intestine. and the herbs are not strong enough to treat the really large worms in the small intestine. That has been our experience. Things might change in the future. Maybe some researchers are going to do much stronger combinations. But again, we always look at toxicity. We want to be safe too. So the parasite drugs in combination with herbs and oxidizing enemas and oxidizing agents have been super helpful. That combination is a real winning combination. So, how do you get access to this drug? It has to be a prescription. So, I spelt that for you, and you're very welcome. Thank you for your kind words. So, Lisa, have the Live Disease Free protocols helped people with Agent Orange exposure? So, that's something that I've never had a student mention that to me. But it doesn't matter what condition we're dealing with. What matters is that every step in the Live Disease Free plan is really helping you to support your health. So, for example, if you were dosed with a toxic chemical, then there are probably ways that will help you to get that chemical out of your body. But if you are restoring balance to the microbes in your body and you're able to, you're detoxing metals, you're getting metals out and your microbiome is in balance and you have a lot of nutrition, then a lot of times we can handle so many different things, right? And we're going into looks like we're going into some pretty challenging times right now in the world. Like, I don't have to go into more detail than that. I think most of people that follow me know that it's pretty unstable. And so it's really important that we're healthy and strong. We need to weather this challenge with as much strength as we have, which is really important. You're very, very welcome. Thank you for. So, again, and I personally would not take a parasite drug unless I needed to. So, it's not like a herb or a supplement. Herbs are different. All these drugs, they have an LD50, right? The dose that killed 50% of the rats. So they are all toxic. It is very well tolerated, but the problem is if we're just guessing and we're taking this drug and we don't know if we're taking the right dose and we try that for a while, it didn't make a difference. These parasites become resistant to parasite drugs very easily. So if you are messing around with it, number one, you may not be able to use it in the future. They can just become resistant, or you could hurt yourself, or it does nothing and you've wasted money. So I personally would not take any parasite drugs because I know that there are different forms where people are desperate, but you can get help and you need to have support and help while you treat. And Daisy, can you eliminate parasites through diet? No, you can't. Unfortunately, they hook onto your intestines and they stay in you. So let's say that you don't eat for 10 days, for example. You're like, I'm going to start. I would not recommend that at all. I think that would be really an awful idea. But if you said, like, I'm just not going to eat for a week, I'm just going to drink water and all the parasites are going to come out of me, right? Because I'm not eating any food. Well, your body is going to start to break down muscle mass. And so your body is going to maintain a specific blood sugar level to keep you alive. And the parasites are just going to live off of that. So, I mean, it's good to decrease the carbs in your diet, like the processed carbs, et cetera, because then you don't get the fluctuations in your blood sugar and they're not feasting, right? They're not binging with you. But you can't starve them to death. Even with our low carb diet, they're going to be much less active. They'll still be present. Many of them are holding on in your intestines. They're not coming out with a bowel movement unless they die. They will come out, but they want to stay. That's their happy place. That's a place where they have lots of food. It's warm, it's moist, lots of nutrition. They have certain ways that they can make your immune system blind to them. So no, they are very happy there and they're going to stay there until they're treated, one way or the other. So Jesse, you'll be joining the Academy this weekend. I'm so excited. So how to find a practitioner in your area. So how to find a practitioner. that I'll go into more detail when you join. But basically, what you're looking for is two different types of practitioners. And that's what we help people to find. You want somebody to do energy testing, and they usually don't do the same. So, somebody who writes a prescription would be like a medically trained doctor, could be functional medicine. In some places, a naturopath, very limited, like maybe one state and one province in Canada and one state in the United States, naturopaths can write prescriptions. But for the most part, it's a medical doctor or a functional medicine doctor that can write prescriptions. And then they usually don't energy test. So they usually don't have that skill. So that could be a chiropractor, um, it could be a naturopath. Usually those are the two that have, it's more than likely that they may have energy testing skills. So you get ready to treat, then you get samples of the commonly prescribed parasite drugs, you get energy tested, you take that list of what you tested well for, and you get prescriptions. You send that back to your doctor, and then you are able to take those parasite drugs. And then because of the work that we have been doing for years with hundreds of people, we have a very good idea. Let's say if you test well for 5 parasite drugs, your doctor will be like, I don't know, like I don't have any experience with these drugs. So then we're like, well, we have a lot of experience with our students using them. So we know that, let's say these 3 you tested well for, they're tolerated really well. And those other 2 are tolerated really well when taken together. So you might take 3 parasite drugs for 14 days, and then you might do the other 2 parasite drugs, or maybe you only tested well for 3 parasite drugs. But number one, we help you so that you're building a plan that you're, number one, you're feeling better before you start treating. And then when you go through the treatment part, it's really important that you don't have a Herx reaction, that you don't have a die-off reaction, because a lot of people are still working, or they just don't want to feel worse. They don't want to be laying on the couch and just wasted. So that is all about, sneaking up on the parasites and not hitting them too hard too quickly, because that's usually what the adverse effects are from parasite drugs, is if you hit them too hard and too aggressively. But you definitely do want to treat them well enough, otherwise they just ignore the treatment, right? All right. So Joanne, your specialist refuses to, oh, let me go back here. So you're on Ocrevus, but your specialist refuses to take you off. Just so you know, Joanne, I'm not a doctor. I cannot give you medical advice, but you are in charge of your body. There is no doctor, there is no healthcare professional, there is no other person at this point in time that has the ability or the control to tell you what you can put in your body and not. I know that the governments have tried just recently with what they've been trying to get us to take, that making it mandatory, otherwise you lose privileges, but still they could not force you to take it. So if you feel that a certain treatment is helpful for you, then continue to take it. But if you feel that it is not doing anything for you and it's actually making you worse, you have every right to say, I've done some research on this drug. I would encourage you to. I would encourage you to read up on Ocrevus and the adverse effects and the increased risk of cancer. And if you feel yourself that that's too big of a risk, then you just go to them and say, I do not feel comfortable taking this treatment. I would like to come off of it. And what is the safest way to do that? So, with this drug that you're talking about, it's an infusion once every 6 months. So, then you would just not get the next one. And that's only if that's what you want, not what I'm saying, not what your doctor's saying, because you are ultimately, you have to live in your body. So you are in control, and you live in a free country, so you have the ability to say yes or no to treatments, and that's very important. So you need to take back control of your health, Joanne. Very important. All right. And Jesse, I am so sick of the disease. I hate watching my brother deteriorate. I'm really sorry to hear that. Oh, that's the Jesse. Yes, I chatted with you. I'm really excited to support your brother. He's young, he has his whole life ahead of him, and I can't wait to support you both. David, can you compile a list of medications that are most successful? Um, I have shared, I look back on our blog post. So I did talk about a lot of different parasite drugs. So there is, again, I'm not saying any of these would test well for you. It's like, do you have roundworms? Do you have tapeworms? Do you have flukes? Right? Do you have Lyme disease? So for there is albendazole, there is mebendazole, there is fenbendazole, there is thiabendazole, there is levomizole. I talked about that one. And again, I'm not saying that these are what you would need. So those are just some of a group of parasite drugs. There's praziquantel, there's Alinea, there's niclosamide, parental palmawate. Those are, you know, close to about 10 different parasite drugs. There's more of them. I'm just not thinking of other ones right now. But, there could be like even hydroxychloroquine, but you could use that for testing, but it's not a cure. So if you do have malaria or babesia and you test well, or protus and you test well for something like that, there are other treatments that would be more of a cure. Then there are herbs. So there's, of course, wormwood and black walnut and cloves are some of the common parasite herbs. There's others also. Artemis, sweet Annie wormwood, artemisinin. That is another one that's really helpful depending if you have protus. And so it's fairly complicated, right, to deal with all of this. And then there's the fungus, right? So there's different herbs that are antifungal and not just yeast, but molds. So there's certain drugs. So there's Sporanox, which is more of a mold medication. And then there's diflucan, which is more of a yeast fungal medication. And then there's nystatin. But then there's all these different herbs too that are helpful, like grapefruit seed extract, and raw garlic is amazing, and olive leaf extract and oil of oregano. And I'm just trying to think, there's so many different ones that can be, I'm trying to think of the name. It'll come to me in a minute. But there's a whole bunch of different herbs that can be helpful also. And so there's drugs, there's herbs, and then if you want to learn about the oxidizing agent, which I can't talk about here because I'll get censored, you can find that on our website, livediseasefree.com. You can just do a Google search of oxygen therapies in treating parasites, and you'll see me talk about that. And I upload the sensitive videos to Rumble because they don't censor there. So Rumble is like YouTube, and they don't censor there. So that's where you can find Live Disease Free on Rumble, and there will be topics there. These topics, which are shortened, but also others. But our website will give you all the links, et cetera, the references, if you would like to look further into these topics. Last couple of questions here. Hi, Allison. Thank you so much for your kind words. I really appreciate it. So I do spend a lot of time researching, and I feel that it's really important that I do this. I feel that this is the difference that I can make in the world, but I'm just one person, right? I'm just literally one person. And I've been doing this for, on a more professional level for at least 10 years. So if you are at the place where, and the censorship is unreal, like if you look back at some of my old videos, I'd have like 100,000 views on it. And now they're not showing our stuff to anybody on Facebook and YouTube because they don't want this information to get out. So it can only get out if you guys share it. So I would really encourage you to share this video. I would encourage you to check out our livediseasefree.com website, share the articles with different groups, get some discussions going, positive, negative, get people talking, because there are people, like I was speaking to a lady today, and it's been years and years and years, and she's done everything, and she's been so let down by the medical system. And luckily, she found me and she can still turn this around. But can you imagine if she would have known early on, before all of this suffering, that she could have just, she could have turned it around. And that's the key, is that if you can catch these parasites early, treat them early, you don't have to go through the hell that many of us have gone through. And that is where we have to go as a healthcare, as our standard of healthcare. All right, so I'm going to let you guys go. Just keep your questions pouring in. We'll be answering your questions. I really appreciate the communication. So make sure to share this video, share our blog post on Friday, and like it. That helps to get it out too if you like it, and you can subscribe if you really enjoy the topics that I'm sharing. And if you're at that place, you're like, Pam, I've been watching a lot of your videos and I really believe that I'm dealing with parasites, then watch my masterclass training. And on that training, I share all the steps we take to recover. And then if you're at the place where you need help, you need support, you don't have a practitioner, then reach out, fill out the form, have a chat with me, and you can join the Live Disease Free plan if that is a good fit for you. So with that, I hope you have a wonderful week. We will talk to you next week. Take care and bye-bye for now.